Welcome, everyone. Good to see, well, I guess not see you, but I'm glad you've joined us today for improving food security and kinship grandfamilies. And you'll remember we use those two terms interchangeably to refer to grandparents and other relatives and close family friends who raise children when parents can't. We'll start in just a minute here, make sure we've got our critical mass in the room. If you would put your name and your role and where you're from in the chat, we'll get to know each other a little bit. And then at 3 o'clock Eastern, so in exactly an hour or about an hour, we'll provide a separate meeting link so that you can join us for 30 minutes for a Q&A with Susan, our presenter. And that way we can be a little more interactive in the meeting format. You can ask questions, you can come off your sound and ask questions directly. But feel free, as questions come to mind during the webinar, to ask them in the chat, and we will collect them and ask them of Susan during that 30-minute Q&A meeting in an hour. And you will all be receiving the slides and the recording to today's webinar in your inbox by the end of the week. So look for that as well. Just a little bit about us. We are the first and only technical assistance center on the families that is federally funded. We have been operating now for almost 4 years. We're about to celebrate our anniversary here at the end of Kinship Month, September 30th. And our purpose is to provide technical assistance to states and tribes and nonprofit organizations around the country to improve their supports for the families. So we work with this array of systems here and try to get them to connect and to learn from each other and to better serve the families. So we are here for you. If you're a professional working with families or want to work with families, or a caregiver that works with other families, we're here. We host a lot of webinars. I just did a tally. We've hosted 34 since we started. I think this is the 34th. Don't quote me, but a lot of webinars. And we answer all kinds of individual requests for help, from just an email response, it's an easy peasy thing, to setting up meetings and really going through any kind of issue areas that you have. We helped somebody today with TANF and questions around how to maximize that program for the kinship families in their state. So don't hesitate to reach out for free of charge assistance. We also are intensively involved in 3 jurisdictions that competed for the opportunity: Idaho, San Diego County, and Oneida Nation of Wisconsin, to help them bridge those systems that we saw in the previous slide for kinship families. And we will be sharing replicable practices from that initiative next year. And then finally, we have a lot of resources, including our webinars that are all there for you to watch at any point on our website, which is at that URL right there. And now it's my privilege to turn it over to Susan Bowden from the Food Research and Action Center to tell you all about the several federal nutrition programs that can help serve the families. So welcome, Susan, and thank you for doing this.
Thank you so much for having me. It's great to gather here today with the Grandfamilies and Kinship Support Network, and with all of you joining the webinar to talk about improving food security in kinship and grandfamilies. Today, I'll be talking about nutrition programs available to help grandfamilies and kinship families put food on the table. And I'll be focusing some high-level information on the programs and sharing some resources that you can use later on to learn more and to connect families you work with to these programs. And I love seeing in the chat, thanks everyone for sharing who you are, where you're coming from. It's great to see that we have a lot of kinship navigators and folks who are supporting these families on the call. And I also saw a couple food and nutrition folks here too. So make sure you're taking note of others in your state and you can coordinate on helping families access these programs. So as I said, I'll be focusing mainly on a high-level overview, and then we'll have some opportunity later on to get a little bit more in the weeds if you have questions, as well as I'd love to connect folks with my colleagues at FRAC who work specifically on some of the other programs, to help you really navigate some of the nuances of these and learn more about best practices as you go along. And of course, the network has a form you can use to submit requests for technical assistance like that on the host of programs and other supports they offer. And we help out with the nutrition space ones. I'll also be pausing at different points in the presentation because I want to hear from you all about what's going on in your communities when it comes to nutrition program access. So stay tuned for a couple of Zoom polls and then a bunch of opportunities to engage in the chat as well. All right, next slide, please. Okay, and whoops, I forgot, I should mention what FRAC is. So FRAC is the Food Research and Action Center, and we work to improve the nutrition, health, and well-being of people struggling against poverty-related hunger in the US. And we do this through advocacy, partnership, and by advancing bold and equitable policy solutions. You can learn more about our work through our website, newsletters, and by reaching out. And of course, we serve for the Grandfamilies and Kinship Support Network as the nutrition subject matter expert. All right, really next slide now, please. Thank you. So before we start talking about the nutrition programs, let's kick off with a little bit of grounding information on food insecurity. So Melissa, will you bring up the first poll, please? All right, you should all see on your screen, and you may have to click back to Zoom if you had it minimized. I'd love to hear how familiar folks are with this term, food insecurity. Oh, it's really fun. I can see the responses coming in live and adjusting. That's great. All right, so a lot of familiarity. That's really wonderful. Some folks who this may be a newer term or not know as much of the nuances of it. So I'll just do a quick bit of that before we dive in. All right, so food insecurity is an economic and social condition when there's limited or uncertain access to adequate food. And this is measured at the household level, which is really key to keep in mind. Food insecurity includes two different levels of severity. There's low food security, which is characterized by reduced quality or variety of foods and worries that food will run out. There's also very low food security, which is when someone in the household is reducing their intake of food. And household food security status can change throughout the year based on the family situation. And it's important to also keep in mind that you can't tell if someone or the household is food insecure based on just looking at them. There's no standard look for food insecurity. So it can be helpful as you're working with families to share nutrition program information with all of them. And to get a sense of the scope of food insecurity in the US, in 2023, 13.5% of households reported that they experienced food insecurity. And we see disproportionately high rates of food insecurity among certain households. This includes Black, Latinx, LGBTQ households, as well as households with children. And for households with children, nearly 18% reported experiencing food insecurity in 2023. So that means about 13.8 million children lived in households that reported food insecurity. And again, it's at the household level. So for some of those children, they may directly be experiencing some of the symptoms of food insecurity, but for others, they're in the household and maybe it's not as severe a level of food insecurity. And so the adult caregivers are doing things to mitigate the harm being directly felt by the children. Though there are, of course, children are really observant and they see that there are changes in what's going on in the household. So really essential to be providing supports to these families. And of course, there are food insecure households in every part of the country, and the rates vary pretty dramatically by state. So you can check out the US Department of Agriculture's data to see the rate of food insecurity in your state and how it compares to the national average. And also wanted to flag that the data for 2024 will be coming out later this week from USDA, so keep watch for that. And we see that many grandfamilies and kinship families face struggles when they have the sudden expansion of the household with children coming into their home. Caregivers may be on a fixed income when the kids come in. They may have to move locations to more costly housing to help add space for the kids, or they may be facing other circumstances that can make it more difficult to put food on the table. And of course, we're seeing rising food costs, as well as costs for other basic needs. So household budgets may be especially strapped. And while we don't have a dedicated and regularly updated look at food insecurity for grandfamilies, I did want to flag that several years ago, FRAC did an analysis for Generations United that found that 25% of grandparent-headed households where there was a grandchild present but no parent present in the household reported experiencing food insecurity. And at the time, that was more than twice the national rate of food insecurity. Next slide, please. All right, so food insecurity and even marginal food insecurity is really detrimental to health, to development, and to well-being. For example, we see in children and adolescents with food insecurity, they're more likely to have overall worse outcome when it comes to their general health, to have increased emergency department visits, and to have higher rates of missing medical care, as well as poor educational outcomes. And we see there are some common ways food insecurity may present in families. This includes food anxiety, diet monotony, decreased nutrition quality, and inadequate food intake. Though, as I mentioned, it looks different in different families, and the way that food insecurity is experienced can change over time. And people in households with food insecurity often describe feeling higher levels of anxiety and stress. Next slide, please. Eight, federal nutrition programs are really important strategies for helping to address food insecurity. So today I'm mainly going to be focused on the US Department of Agriculture programs like SNAP, school meals, out of school time programs, child adult care food program, and WIC. I'm also going to touch on food distribution programs that USDA offers, and then a quick bit on the home delivered meals and congregate meal program, the latter of which are administered by the Department of Health and Human Services. These programs are funded and administered at the federal level, and then they're implemented at the state and local level by entities such as government agencies, schools, community organizations, and faith houses. And how exactly that implementation works varies by the program. And the programs that are administered by USDA are, for the most part, entitlement programs. So that means there's federal funding provided so that all who are eligible can participate in those programs, and the programs are available in communities across the country. Most of these programs are means tested, meaning that they're designed to help families with low income, and eligibility is based on household income. There are, of course, some other programs I'm not going to be touching on today, like Senior Farmers Market Nutrition Program, or your state may have additional state-funded programs, but it's always good to be aware of those programs as well, so you know the gamut of resources that may be available to the families you work with. And if you're a Kinship advocate or navigator on the call today, and you're not already connected with anti-hunger organizations or food banks in your state, I recommend reaching out to them. That's a great partnership to help you learn all about the different programs and ways to connect families. All right, Melissa, will you bring up the second poll, please? Great. So before we start the program review, I'd love to hear from you all if you've already connected families to some of these programs. And you can go ahead and check all of the ones that apply. Excellent. Folks are going to town. Great. And we'll just give you one moment to go ahead and respond to that one. All right, excellent. Seeing a really good spread here. I love seeing this. Lots of nice awareness of different programs, connections to them. All right, this is great. So some of the information today may be just a bit of a review first for you all. Some maybe folks have connected families to SNAP. I see that one. And food banks and pantries and distribution are our highest response rates. So maybe a refresher there. Maybe we'll get some new pieces in here as well, particularly when it comes to serving grandfamilies and kinship families. All right. And there's a strong body of research on nutrition programs that show the many benefits to families and communities. But of course, it's not uncommon for families to not be aware of these programs or how to access them, or for there to be outdated or incorrect information that's circulating in communities. And some families may have also applied in the past, but were found they weren't eligible at that time. And so they've kind of crossed it off their mental list as a resource for them. So stakeholders like you, connecting grandfamilies and kinship families to the programs and helping to address any barriers they may encounter is really essential, especially as we talked about before, food is really expensive right now. All right, next slide, please. First up is SNAP, the Supplemental Nutrition Assistance Program. This may be called something else in your state, like if you're in California, it's called CalFresh, or families in your area may refer to it just as EBT, or they might still use the older term for it, food stamps. And SNAP provides households with funds to buy food at local retailers, and it's available to folks of all ages and all across the country. Individuals and families apply for SNAP through their SNAP agency. And in some areas, a nonprofit organization like a food bank or an anti-hunger group may be able to help filling out that application and submitting it. The SNAP agency then looks at the application, determines if a household is eligible, and if they are, the benefit amount they're eligible for. And they use factors like household income, certain expenses that they use to calculate deductions, and the household circumstances, like how many people are in the household and what are the ages. For SNAP, a household is comprised of people who purchase and prepare foods together and live together. So you don't need to be legally related to be in a SNAP household together. And then households who are approved receive an EBT card. That's an electronic benefits transfer card, looks like a credit card. And each month their SNAP benefits are loaded onto that card and used to purchase food at participating retail stores and markets. Next slide, please. Great. And I'll mention this for a couple of programs, but there is a lot of great research out there on the benefits. So for SNAP, the program helps tens of millions of households with low income to buy food, and it improves food insecurity and health outcomes. And the program is designed to expand during hard economic times or natural disasters so that it can meet rising needs in communities. And SNAP also benefits the broader community. For example, for every $1 in SNAP benefits that are spent during an economic downturn, it generates around $1.50 to $1.80 in economic activity. Next slide, please. All right. So grandfamilies and kinship families can contact their SNAP agency to apply. In many states, they can do the application process online if that's of interest to them. And as I mentioned before, there may be groups in the community that can help them navigate that process as well. There's also a SNAP pre-screening tool that's linked here. And you can, households can use that to see if they may be eligible for the program and also to get an estimate of the benefit level that they may be eligible for. Though I want to be sure to note that it's really important for households to go ahead and apply for the program if they think they may be eligible, so the SNAP agency can tell them for sure and what their benefit level would be. Next slide, please. Right, a few notes on SNAP that can be particularly good to know when working with grandfamilies and kinship families. So as I mentioned before, SNAP households are people who live together and purchase and prepare foods together. So a caregiver does not need legal custody or guardianship of the child they're raising to apply for SNAP. They just need to be able to list that child or the children living with them when they apply, and the agency can help them navigate that process. Also important to note, for grandfamilies or kinship families where there's someone in the household who's an older adult or someone with a disability, there are special rules to help those populations qualify for SNAP. For example, allowing out-of-pocket medical expenses to be deductive when calculating eligibility and benefits. Another important fact, and this is one we'll hear about, is how will this affect my Social Security benefits? So Social Security checks will not be reduced because someone is getting SNAP. Their SNAP benefit the household is going to get is going to factor in that funds that comes from the Social Security benefit, along with other sources of income and other household factors. But getting SNAP isn't going to lower someone's benefits from Social Security. And one final SNAP tip: households can participate in SNAP and other programs at the same time. And participating in SNAP can also help to streamline access to certain other programs like school meals if there are kids in the household. Also, in some areas, SNAP participants may be able to access other free or discounted services like cell phones, classes, or museum entrance fees. And you can learn more here with this resource from the network. Actually, we have 2 SNAP resources here, so be sure to check those out later on. Next slide, please. All right, thank you. So before we move on to talking about child nutrition programs, I did want to also acknowledge that there are some major changes that are coming to SNAP. So a lot of these are, they're not going to be implemented immediately, and there's a lot of details that still need to be determined. But I did want to flag that state SNAP could look very different in your state in the coming years. So one big factor here at play is that earlier this year, HR 1, known as Budget Reconciliation, or the One Big Beautiful Bill Act, was passed. That bill makes major future changes to certain facets of SNAP. As just 2 examples, it changes the amount of funding that the federal government will provide to states for the program, and it expands the time limits on eligibility for certain people, including some changes to eligibility timelines that may affect kin and grandparent caregivers. Separately from that, some states have applied for and USDA has been granting waivers that allow these states to place new limitations on what food items SNAP participants can purchase with benefits. As I said, a lot of these are coming in the future and the details are to be determined. But I encourage you to go ahead and check out FRAC's resources, particularly our blog, which has a lot of updates posted there on what we may see in the future and staying up to date on what may be happening with SNAP in your state. Next slide, please. All right, next up are the school meal programs. So the school breakfast program provides funds for participating schools to serve breakfasts that meet high federal nutrition standards. And some of these breakfasts can be served in the cafeteria, while at other schools, they may be served in the classroom. These breakfasts are provided to students at the free, reduced price, or paid rates, and the payment level is dependent on the household income. In a bit, I'll also talk about the different ways to access free or reduced price meals, and also how some schools are providing free meals to everyone in the school, regardless of their household's income. Next slide, please. School lunch, just like school breakfast, these meals can be available at the free, reduced price, or paid rates, depending on the household income, and they must meet high federal nutrition standards. Like with SNAP, there's a deep bench of research showing that school breakfasts and lunches have positive impacts for students. These meals reduce food insecurity, they help support academic achievement, and there's actually research to show that for many school children, school meals are the most nutritious meals they receive. It helps them to consume higher rates of milk, fruit, vegetables, and lower rates of snacks and desserts. Next slide, please. All right. There are different ways students can access school meals at the free or reduced price rates. So a student can be automatically eligible for school meals if the household participates in SNAP, TANF, the Food Distribution Program on Indian Reservations, or Medicaid in most states. Or if the student is considered to be homeless, unaccompanied youth, a runaway, a migrant, or if they're participating in Head Start or in foster care. And if none of these categories fit, the student's caregiver can go ahead and fill out a school meal application that helps to show that they're eligible for free or reduced price meals based on their household's income. As referenced before, in some schools, districts, or states, all of the students are being provided with school meals and no charge to the family, regardless of the household income for that student. Schools may be doing this through a federal option that's called the Community Eligibility Provision, and that allows high poverty schools and districts to provide meals to all students at no charge to the families. During the 2023-2024 school year, 60% of schools in the US offered free meals to all students using this federal option. And then some states have also passed legislation in recent years to use state funding to offer free healthy school meals to every student. And whatever mechanism they're using, offering meals to all students at no charge helps to increase participation in the school breakfast and lunch programs. It helps to reduce stigma, and it also eliminates unpaid school meal fees and streamlines school nutrition operations. So lots of benefits there. And since these options can vary on how to access free or reduced price meals, it's best for a caregiver to contact their school's food and nutrition services department, and they can help them learn about, do they need to submit an application or not, or what's going on in their individual school. Okay, next slide, please. And if you're curious to learn about whether your state has state-funded healthy school meals for all, FRAC has a website and a map you can check out the status in your state. Next slide, please. A few quick notes, and then be sure to check out our resource here for much more. So again, caregivers don't need to have legal custody or guardianship or be related to the child they're raising to access free or reduced school meals. And it can be helpful to know that for most schools, if they do accept school meal applications, they're going to be starting to do that right before the start of the school year. However, you can apply at any time throughout the school year. So if a child comes to live with a caregiver midway through the school year, the caregiver can go ahead and apply at that time to see if their student's eligible for free or reduced price meals. And if the caregiver's household circumstances changes, like their income decreases or the household size increases, that's a great time to reapply if they were maybe getting reduced price meals previously, and then they may now be eligible for free meals. All right. You can, of course, learn more with our resource here. Next slide, please. All right, before we move on, I do want to take a quick moment to hear from you all. So if you could just drop in the chat, if there's one or more strategy you found has worked well in your area to connect Grandfamilies and Kinship families to nutrition programs. I'd love to get some information on that. It can be a program we've already talked about a little, it can be a new program, or if you haven't connected families to nutrition programs yet, but there's a strategy from another program you've worked on, I'd love to hear about that one as well. All right. That's great. Thank you, Donnie. Awesome. So folks are really engaged and know where the pantries in their neighborhoods are. Those are great resources, particularly for someone is looking for food right now, or a regular group they can connect with. That's great. Awesome. All right, keep dropping those in there, and we'll also have a time in the Q&A section to talk about strategies. But I'm going to keep going for the sake of time. So next slide, please. All right. Next up are meals for kids when they're outside of school hours. So in the after-school time, after-school nutrition programs can help fill the gap. These programs provide federal funding for meal sites to offer up one meal and one snack per day to children who are 18 and under. And these are served during after school time or can be served on weekends or like shorter school holidays. Sites are either located in areas that are deemed to be low income, or they serve primarily children from households with low income. Next slide, please. Again, there's lots of research on the benefits of these programs. After school nutrition programs, combat hunger and food insecurity, and they ensure children have access to the nutrition they need to help them stay engaged in after school programming. And these programs also help support the operations of schools, meal sponsors, and after school program providers by providing these reimbursements for meals and snacks. Next slide, please. Right. And after school meals and snacks, as I mentioned, can be available for children and youth who are 18 and under. who are enrolled in programs at participating community sites, such as schools, parks and recreation centers, libraries, faith-based groups, or community centers. And once a site qualifies, the children who participate at the site will receive meals. They probably don't even know that the meals are coming from the after-school nutrition programs. But you can find out more about after-school meal sites in your area through your state agency. Next slide, please. All right, summer nutrition programs. So again, when summer lets out, millions of children no longer have access to those healthy meals they were receiving at school each day. So summer meal programs can help fill this gap by offering meals and snacks to children and teens at no cost to their families. Through these programs, summer meal site sponsors like local governments or schools or nonprofits can use federal funds to provide these snacks and meals at places where children are gathering. Most summer meal sites also provide educational or enrichment activities or recreation, and those help to keep kids learning and active and safe when school is out of session. Through these programs, meals must be served on site unless the site is participating in the rural non-congregate option. This option is relatively new, and it allows families to take meals home with them rather than the kids to consume the meals on the site. And this program is designed to help fill the gap in rural areas where families may be facing increased barriers with transportation or other access pieces. Next slide, please. All right, and then probably a lot of folks have heard about this one, whether it's by this name or some of the other names that the program had functioned under previously. But a newer summer food program offering is Summer EBT. This program grew out of some pilots that happened back in 2011 or so, and also the pandemic EBT program that was available in 2020 to 2023. It became a permanent program option as Summer EBT last summer in 2024. So this program provides families approximately $40 per month per child to help with food costs during the summer. And these funds are loaded onto an EBT card, and then the family uses it to purchase food at participating retailers. Next slide, please. As I mentioned, summer EBT is a program option, so states have to opt into participating in the program. You can see here for 2025 if your state offered summer EBT or not. Next slide, please. All right, and so first up with the summer meal programs, to access summer meals, a lot of those program sites are considered to be open sites, and this means any child or teen who drops in is welcome to a meal or the snacks they're serving. Their family doesn't need to submit paperwork, they don't need to show ID or anything, they just show up when the meals are being served. There's also an option for something called closed sites, and those are for if you're doing an associated program that has kids who sign up in advance, then those meals are provided to the kids who are enrolled in those programs. You can find out about summer meals and what's available in your community through your school district or your education department, or USDA also has a mapping tool to help with that. For summer EBT, most children in participating states don't need to submit any sort of application if the state's offering summer EBT for that summer. In some cases, an application can be required, and FRAC has an eligibility guide that can really dig in on some of those pieces. Next slide, please. All right, so if you check out the network's resource on summer programs, that can help you learn more about connecting Grandfamilies and kinship families to these programs. And if you're an organization that provides programming during the summer or after school or on weekends, you may want to consider checking out these programs to see if they could help you draw down federal funds to provide meals and snacks to the kids and youth you're serving. Next slide, please. All right, so next is the Child and Adult Care Food Program, or CACFP. Next slide, please. A colleague used to refer to this as school meals for the little ones, which I've always found to be a helpful shorthand. So for that section of the program, when you're serving young children, CACFP helps to fund meals for Head Start, early Head Start, child care centers, and family child care centers and homes. They can use these federal CACFP funds to offer healthy snacks and meals to the young kids in their care. The program can also be used to pay for meals at adult day programs and at emergency shelters. Next slide, please. All right, so CACFP helps to nurture children with nutritious meals and snacks that promote their healthy growth and learning at a really integral time in their lives. And it also helps to support families and childcare providers because they don't have to then be paying themselves for those meals and snacks. They're able to get that federal reimbursement. Next slide, please. To find out what childcare providers in your area participate in CACFP is a really helpful strategy so that you can refer families to those. You can also contact your state agency that implements CACFP. It's also often the education department. Or if you're already connecting kids to Head Start programs, that's a great strategy. You're already connecting them to someone who's using CACFP. Next slide, please. All right, now to WIC, or the Special Supplemental Nutrition Assistance Program for Women, Infants, and Children. So WIC is available for people who meet 4 criteria. They're either a child up to age 5, an infant, they're pregnant, or they're postpartum within a certain period. What's key here to know when you're working with grandfamilies and kinship families is that for infants and children who are eligible for the program, their grandparents, foster parents, or other caregivers can apply on their behalf. To be eligible, after you meet that category standard, your household income needs to be below 185% of the federal poverty level, or if the family has what's considered adjunctive eligibility. That just means they're considered to be automatically income eligible based on participation in Medicaid, SNAP, or TANF. And in some states, they're starting to also accept Head Start for that automatic eligibility determination as well. They also look for eligibility if the applicant is determined to be at nutrition risk. And this could be either like a medically based risk, such as they have anemia, or it can be a diet-based risk, such as inadequate dietary pattern. And you're going to have a health professional who determines that. It's often a staffer at the WIC clinic will be able to do that assessment. And it's really rare for someone to not meet that nutrition risk requirement. And finally, they want to make sure you're applying in the correct jurisdiction based on where you live and where the WIC clinic is. Next slide, please. Right. WIC participants are going to receive a host of important services. This includes healthy foods, nutrition education, screening and referrals to healthcare and social services. And for those participants who are postpartum, they also receive breastfeeding support if they're going to be breastfeeding or they're interested in trying that out. In terms of the nutritious food parts, WIC provides supplemental foods that are designed to address the specific nutritional need of the participant. And these foods are provided by a monthly food package. And those are assigned from one of 7 science-based food packages. And they're determined based on the participant's life stage and their nutritional needs. So you might see in these food packages items like eggs, whole grains, beans, yogurt, infant food, or formula. And you can also get specialty formula through WIC with a doctor's prescription. The way the WIC food package works is that you're guaranteed a specific amount of WIC food each month. So for example, you may get 1 dozen eggs each month with your benefit. The exception here is that there's, for fruits and vegetables, a cash value benefit, and that allows participants to select which fruits and vegetables they want to purchase. The fruit and vegetable cash value benefit for children participants is currently $26 per month. And these food package benefits are loaded onto the WIC EBT card, and that's used to purchase the approved food package foods or formula at participating vendors. Next slide, please. All right. And so caregivers who have a child or an infant in their care who may be eligible for WIC, go ahead and apply through their local WIC clinic. Your state WIC agency can help you find WIC clinics in your area that you can go to apply, or apply over the phone, or other means if they allow for remote applications. And they can also help you figure out what materials you'll need to fill out that application. USDA also has a pre-screening tool that can be used by caregivers to see if a child or children in their care may be eligible. Next slide, please. And we have a resource here from the network that you can use to learn more about WIC for Grandfamilies. And just to highlight a couple pieces from here, WIC, as I mentioned, provides nutrition education and counseling. And through this, households are able to access nutrition resources and materials. And these can help both the children participants as well as their caregivers get strategies to help improve their nutrition. It also shares information on what grandparents and other caregivers need to do when applying for WIC for an eligible child in their care. All right, next slide, please. Another question for you all. So if you could drop in the chat for me. So we talked a bit about strategies before. Now I'd love to hear a bit about barriers you've seen. So what barriers have you seen in your area when it comes to connecting grandfamilies and kinship families to nutrition programs? So I'll just pause for a moment to let folks go ahead. Yep, for sure. Thank you, Kamika. Income's one we hear about a lot, especially with programs that are based on household income. And there are definitely some strategies that can be put forward to help folks maximize deductions, like for SNAP, to make sure they're calculating their income eligibility correctly. Transportation, for sure, big barrier there. We have seen some encouraging pilots for, well, I'll mention the WIC program, as we were just talking about that, but some states are now doing new pilots where WIC families with, they're going to be rolling out the opportunity to do online ordering and delivery using their WIC benefits, which can really help with some transportation barriers. All right. So let's talk a little bit next about food distribution programs. So next slide, please. Thank you. So first up is TFAP, the Emergency Food Assistance Program. This provides food banks and pantries with support that allows them to distribute food to community members. And food banks and pantries are really vital ways to get food when people need immediate help, and can often provide recurring help if the family continues to need it. Some food banks also provide other resources, like they can help with SNAP applications, or they provide summer meals for children and youth, or they sometimes have non-food personal care items, or can help refer to other services. And of course, the type of food, hours of operations, and who can be eligible for these services can vary. So if you aren't already connected with the food pantries or food banks in your area, Feeding America is a great first stop to figure out what's going on in your area. And it was great to see in the chat earlier, a lot of folks are already connected with those pantries and food bank networks in their state. So glad to see you connected there. Next slide, please. Next up is the food distribution program on Indian reservations. This is for households with low income who are living on Indian reservations, and for Native American households who are residing in designated areas near reservations or in Oklahoma. And through the program, they receive a monthly food package. And these food packages include items such as fruits, vegetables, proteins, legumes, grains, soups are also available sometimes. And depending on eligibility, they may also have traditional foods available as well. It's important to note, as we're looking at this array of different programs, that households cannot participate in the food distribution program on Indian reservations and SNAP within the same month. You can switch between the programs as it works for you, but it can't be within the same month to get both of them. USDA has a page you can check out to see if the area you're in and the families you serve may be covered by one of the 107 Indian tribal organizations or the 3 state agencies that are administering this program. Next slide, please. All right, and now we have the Commodity Supplemental Food Program. This is for older adults age 60 and older who have low incomes, and they can receive a monthly box of commodities, and this can contain foods like cereals, beans, tuna, cans, fruits, and vegetables, and it's meant to supplement their diets and improve health. These boxes are typically picked up at a local food bank or another sponsor organization, or with some of the programs, they may be offering home delivery of these boxes. This one does have limited funding, and it is limited to certain geographic areas. But you can check out with USDA if it is available in your area. Next slide, please. All right. And finally, I wanted to touch a little bit on the Older Americans Act nutrition programs. So the Congregate Meals Program is used by community sites to serve nutritious meals to adults who are age 60 and older, and offer opportunities for them to gather and socialize while they're enjoying those meals. Those meals are generally lunch and can be served Monday through Friday. And they have to be designed so that they meet 1/3 of a person's recommended daily dietary allowance. Home delivered meals provides funding for meals to be sent to older adults, again, age 60 and older. And these meals, since they're delivered to the home, they can be hot prepared meals, they could be frozen meals, or they could be shelf stable. And home delivered meals programs in your community may have different eligibility rules based on whether they're using these federal funds, they're using other funding sources, or a combination of those. These programs are not entitlements, so they do have participation caps, and they're not going to be available in all areas. So there is a really great array of programs around the country. And some of the programs they're free, but they do accept voluntary contributions. While these programs are targeted to those who are 60 and older, if someone who's an older adult is attending a congregate meal site, for example, their younger spouse, or if they have someone in the household who's younger than 60 but has a disability, they're going to be also eligible to go to those meal sites and get a meal with the older adult in the household. If you check out the Elder Care Locator, they can help you see what's available in your area. Next slide, please. All right, so those are the programs today. Before I wrap up by talking a little bit more about resources, I'd love you to answer another question for me in the chat. So this one is, what resources, training, technical assistance, or like relationship building would help you to connect more grandfamilies and kinship families to nutrition programs? So I'll just pause for a little bit here while folks are thinking about what resources or other supports would help to connect more families. And I'm excited to have a moment to check out some of the information on barriers, because that'll help tie in with this question as well. Right, nice. Training to use technology to apply for programs. That's really helpful. Thank you, Rochelle. Oh, yeah, I see some good discussion here on, for sure. So, and this is something we can cover a bit in the Q&A section, and I'd be happy to connect folks with my SNAP colleagues. But if a child was already on SNAP when they were living with their parent or another caregiver, and then they've moved households, they would have to be removed from that original household case before the new household where they're currently being cared for can be receiving benefits with that child factored in. So the agency is going to have to help a household navigate that changeover. All right. Great, yeah, so information on guidelines to help them qualify. Hopefully some of the resources here, if you have a chance to check those out afterwards, will help provide some of that information. Excellent. I love this. Thank you, everyone, for humoring me. This helps me learn a lot as well. All right, next slide, please. And here, these are sprinkled throughout, but did want to also collect our different resources that the network has available to help folks learn more about connecting grandfamilies and kinship families to different nutrition programs. Also a plug here for Generations United's annual State of Grandfamilies report from a few years ago that we provided support on that digs deeper into the issue of food insecurity and nutrition support for grandfamilies and kinship families. And thanks to the network staff who have been dropping the resource links in the chat as we go as well. And as was mentioned at the top, the webinar slides will be going out. So you'll be able to access the active links in that as well. All right, and then I also have a link here if you're interested in signing up for FRAC's emails. You can learn more about nutrition programs and other trainings, as well as request technical assistance from FRAC staff through the network. All right, next slide, please. One more participant question for you all before we move on. So final question is, thinking about today's webinar, I'd love to hear what's one action you'll take after today to connect grandfamilies and kinship families to nutrition programs. All right, share these tools. Great, thank you, Macy. Become more familiar. Great, Beth. Yeah, let us know how we can support. If there are additional resources that could be helpful for the network to push out, we'd love to learn more about that and see how we can help support there. Knowing what's available for sure. Sorry, the text is so tiny, I have to get closer to be able to read the chat. Great. Oh, and I also wanted to mention for our school meals resource, we do have an update coming from the network on that very soon. So stay tuned there. And that will have, in addition to the base level information, a new flyer that can be passed out to families to help educate them about school meal programs. And then we'll have some holistic look pieces coming soon as well. So more resources coming your way. All right, next slide, please. So there's my information. You can also reach me through the TA link that the network has. Thanks for hanging in with me with a lot of information on the quilt of different nutrition programs. And I'm excited to join you in the discussion part after the wrap up here to learn more about what you're seeing in your communities.
Thank you so much, Susan. That was really informative. I think we all learned a lot, and do know that those resources that Susan shared, they've been designed very carefully so that they're helpful for caregivers too. Yeah, please distribute them, use them, read them yourselves, and let us know how we can be of any further assistance. Also want to remind you to celebrate Kinship Month this month. It's all September, and the network has created a toolkit, a digital media toolkit, which has general awareness raising pieces that you can share, so social media posts with graphics, a couple of infographics, newsletter copy. We're trying to make it as easy for you to push out the month. And many of the graphics are neutral, so they don't have our logo on them. And we want to celebrate and have more people aware of kinship families and grandfamilies. And please use the hashtag Kinship Month 2025 when you do push these materials out. We have two upcoming webinars this month, one with our partner at the National Indian Child Welfare Association on strengthening state and tribal partnerships to better serve families. And then the other one is about data-driven insights on kinship placements and kin stability within foster care. And so we hope you will join us for both of those free webinars.